So today we're going to do some Kybella, which if you haven't heard of it is the new fat-busting drug that's used underneath of the chin. We're going to walk Laura Beth through this. She's our office manager, being very brave today with us. You look up right here. What you can see is we have this little grid that we lay down right here, and that sort of guides our injection points. This is exactly like a tattoo that your kid has. We just stick that on with some water and then those will rub right off. But that's how we know how much drug to inject exactly and where to go. Right there, that'll come off right after. So what we've done is numbed up this entire area so that the patient doesn't have to feel anything. This is a really itty-bitty teeny little needle, so the risk of bruising is really pretty minimal, and the injections themselves go really, really quick. So here we go. Ready, Laura Beth?
Yes, sir.
Here we go. And what we'll do is we'll just use this grid as a little guide. We're just injecting the same amount every time we go down.
I don't feel a thing.
Wonderful. As you can see as we're going along, there's really no bleeding or anything. This is such a tiny little needle. All right, so we're here with Laura Beth, who had Kybella 2 days ago. Laura Beth, go ahead and tell us about what your experience was like, what your swelling, pain, anything that you experienced.
So after I left the office, I went and picked up my son from school. I went home. I had a bandage around my head. For the first 24 hours, I didn't experience any pain or anything like that at night. I slept, a little elevated, but nothing worse than that. And it was great. Didn't have no complaints.
So today when you came in to work, being 2 days later, were you worried at all about how your swelling looked or what the area under your jaw worked, or were you self-conscious about that?
Not really. When you're looking straight on, you don't notice it as well. If I do a profile, you can see it a little bit more, but my hair pretty much covers it, so it wasn't bad.
Great. All right, well, we'll look forward to your next injection.
Cool, thanks.